Taking part in NHS breast screening. We offer screening because it can save lives from breast cancer. Breast cancer is the most common type of cancer in women in the UK. One in 7 women may get breast cancer in their lifetime. Breast screening can find signs of breast cancer at an early stage. We look for cancers that are too small for you to feel or see. Finding breast cancer early means that your treatment may be simpler and is more likely to be effective. Breast screening is for women aged 50 and older. We first invite you when you are between 50 and 53 years old. We then invite you every 3 years until you turn 71. If you are 71 or over, you can still take part, but you need to contact your local breast screening unit to make an appointment. If you are transgender or non-binary and you would like to be invited for breast screening, talk to your GP surgery. Visit the gov.uk website for more information. You should contact your local breast screening service if you need to cancel or change your appointment. Before your appointment, you should let your screening service know if you have a learning disability or mobility problems and need extra support. This could include a carer coming with you, or information in another format or language. Before your appointment, you should also let them know if you have breast implants, have a pacemaker or any other implanted medical device, are pregnant or breastfeeding, have had both breasts surgically removed, a mastectomy, are under the care of a breast consultant, have had a mammogram in the last 6 months, please do not use deodorant or talcum powder on the day of the appointment, as it could interfere with your result. Remove necklaces and nipple piercings before you arrive. Breast screening will usually be in a hospital or a mobile screening unit. It uses a breast X-ray called a mammogram to take images of the inside of your breasts. A specialist, called a mammographer, will take your mammograms. They will be female. You will have 2 mammograms taken for each breast. Each one only takes a few seconds. The appointment should take no more than 30 minutes. You will need to undress to the waist. You may prefer to wear clothing that makes this easier, such as trousers or a skirt and a top. You will be given privacy to undress. You can also bring someone with you for support, such as a friend, relative, or carer. They will usually need to stay in the waiting room during your appointment. After your appointment, specialists check your mammograms for signs of breast cancer. You should get your results within 2 weeks. There are 2 possible results: no further tests needed at this time, or further tests needed. Around 96 people out of 100 taking part in breast screening do not need further tests. Around 4 out of every 100 people do need further tests, and are invited for a breast assessment appointment. Most people who need further tests do not have breast cancer. If we do find breast cancer, we will offer treatment. We cannot always predict if a cancer will become life-threatening or not. This means people sometimes get treatment for a non-life-threatening breast cancer. If you are offered treatment, the specialist team will explain the options to you to help you decide. No screening test is 100% reliable. Sometimes cancers cannot be seen on the mammogram, and very rarely a cancer may be missed. Having mammograms exposes you to a small amount of radiation from the X-rays. This very slightly increases your chance of getting cancer over your lifetime. Research shows the overall benefits of breast screening outweigh the risks of radiation exposure. Please contact your GP surgery as soon as possible if you think you have symptoms of breast cancer. These can include a lump or swelling in your breast, chest, or armpit, a change in the skin of your breast, such as dimpling or redness, thicker skin with more obvious pores, a bit like orange peel, a change in size or shape of one or both breasts, nipple discharge, which may have blood in it, a change in the shape or look of your nipple. Pain in your breasts is not, on its own, usually a sign of cancer. But if you have pain or discomfort in the breast or armpit that's there all or almost all the time, it's best to get it checked.